research shows that more Filipinos are becoming prone to critical illnesses such as heart disease, stroke, and cancer. Now, aside from affecting our finances, these critical illnesses will also affect quality time with our family. So, what can we do to help us prepare against critical illness-related setbacks? Well, joining us today are Dr. Jun Aventura, Head of Coronary Surgery of the Philippine Heart Center, and Mr. Eric Nicdao, Financial Advisor from Philam Life. Good morning, gentlemen.
Morning. Good morning, Paolo.
Now, Doc, why is it so important that we be, concerned with those illnesses that we mentioned leading into our discussion?
Yes, well, as of now, Filipinos are prone to heart disease. Mm-hmm. Almost 9 out of 10 are prone to heart disease. And also, 11 patients are diagnosed with cancer in an hour.
Right.
So every hour, that is.
Mm-hmm. Well, this is startling figures here, and it really is a little bit sobering. How, what will happen, and yes. Keep your fingers crossed that it doesn't happen to you. How should one prepare for critical illnesses like these?
Well, first you have to have early detection, mm-hmm. early screening, so that once you get screened and diagnosed, it's still in an early stage, and you can still do something about it.
Right.
Another thing is to change your lifestyle for the better, mm-hmm. Like eating right and exercising.
Right. Okay. If it does happen to you, it takes a toll on your health, yes. It takes a toll on your family, and most of all, it takes a very big toll on your finances.
Right.
It's a real drain on the finances.
Correct.
Can you give us an idea of what it costs to actually treat an illness like this, to recover?
For example, a heart disease. Mm-hmm. You could either have just medications.
Right.
Sometimes depends on the treatment. Mm-hmm. Sometimes you can have what do you call stenting or PCI.
Okay.
Another thing is CABG or bypass surgery.
Right.
And bypass surgery would probably cost about maybe from 700 to $1 million.
Right.
So that's really taking a toll on your finances.
Right. It's sort of a double whammy, really. I mean, your health suffers, your family suffers, and like we said, it takes a real toll on the finances.
That's correct.
As somebody who's familiar, obviously, with finance and how people can be a little more prepared for something like this, what is your advice for people to be a little more prepared? Because inevitably, someone in the family does get sick, and when it does happen, you want to be a little more prepared.
That's correct, Paolo. In fact, the harsh reality is only 2 out of 10 Filipinos are financially prepared for serious illness. Mm-hmm. So Philam Life has this plan called Health Invest Plus.
Okay.
It is a health, life, and investment program in one. Mm-hmm. It takes care of your health at present and in the future. Mm-hmm. And it also helps people prepare financially, even at the early stages of critical illness.
Right.
So this is how it works. Mm-hmm. If one is diagnosed with critical illness, Health Invest Plus covers a very comprehensive list, 56 critical illnesses, mm-hmm. like heart attack, cancer, stroke. There is already a lump sum to be given to the person with the program.
Okay.
And if there is any premiums that have not yet been paid, all these premiums will be eventually waived.
Okay.
So it's fully complete.
Right.
And there are some illnesses that are detected at an early stage,
all right.
which we cover. Mm-hmm. For example, cancer, stage 1. Mm-hmm. There is already a 25% that will be advanced to the person that he can already use for early treatment. Right. And this is important because not all programs have this.
Okay.
And, Paolo, the earlier you detect a illness and the earlier you have it treated, the higher the chance of getting well from it.
Right. I'm sure Doc over here will agree.
Yeah.
What happens though, I mean, oftentimes people try to be a little more forward-thinking and prepare for something like this. I think what sort of, how would you say, causes some concern for people is, okay, it's nice, it's good to be prepared for illness, but what happens if I don't get sick? I mean, when you do get sick, you think you're lucky stars that you did think ahead and invested in a plan to sort of cushion the fall, so to speak. But there's also that little part of you that will say, well, sayang naman yung money. Well, what happens to the money if I don't get sick or if I don't get to use it?
Yes, that's correct. And this is where the investment component kicks in. For every premium that a person places in, it is invested in expertly managed investment funds that can earn much more than what the traditional bank can give.
All right.
So that in the long run, Paolo, if the person keeps on putting his premiums, the fund grows and it can become a supplement medical fund that the person can use for medical needs or for other personal needs in the future.
All right. When you say other personal needs, does that, it doesn't have to come with a doctor's certificate, does it?
That's right. For vitamins, for medicines, for geriatric care, nursing care.
All right. Okay. So it's a little more broad.
Yes.
Philan Life is offering this. Traditionally, Philan Life. Does that sort of come into play with an investment like
this? Yes, definitely yes. So it has a life insurance component as well, so that in the event of death, the beneficiaries get the life insurance coverage. Or the account value, the health fund, whichever is higher.
Okay.
And it also has an accident component that covers serious disability due to accident.
All right. Well,
so in summary, Paul, this plan is very comprehensive. It has a health care, a health plan, and an accident program. The health plan covers a person way beyond 65.
Okay.
Most programs cover only up to 60 or 65. This one goes beyond 65. It has an early critical illness coverage. It has a health fund that builds up in time. It has a life insurance component. And finally, it's very easy and very affordable. It comes in very flexible packages, 3 years, 5 years, 7 years, and 10 years.
All right.
So with this program, with these benefits, you can have peace of mind. You can be assured that whatever happens, you're prepared for it. And you can just give time and quality time to your family.
All right, sounds good. Well, I mean, it seems like the theme pretty much for the discussion really is to be prepared, and to sort of do what you can to avoid these situations. If you had to sort of wrap it up in a few parting words for us, Doc, how can people be a little more prepared or to avoid conditions like this?
Well, as I said before, early detection, just have yourself screened earlier, take labs, go to your doctor, have an early screening, and also lifestyle change.
Right. Okay, so don't wait till it's too late. Same with being prepared financially. Don't wait till it's too late. I'm sure a lot of people might be thinking, okay, I want to start now. How can they get a few more details or get in touch with you guys?
Well, they can contact their Philan Life financial advisor if they know anyone, or they can call the hotline 528-2000. That's 528-2000. Or they can log into philanlife.com.
All right, good stuff. Well, I want to say thank you very much to Dr. Aventura and Mr. Nicdao for joining us this morning. Thank you, gentlemen.
Thank you.
All right, folks, Meryl Streep picks up a guitar for her rocker chick role in our sneak peek. Don't miss it here on Mornings at ANC.